What the fuck?
Justin Trudeau's premiership hasn't exactly...
Okay.
He's been a whirlwind of policy triumphs, but the one exception, and the one he bragged about most when hanging out at foreign galas, was the carbon tax.
I don't know what else I'm supposed to fucking do. Pain in the ass.
Canada became one of the world's only countries to do what economists have been telling everyone to do this whole time. If you're worried about emissions, put a price on them, and the market will sort itself out. But then Atlantic Canada became the last region of the country that slapped onto its fossil fuels. Almost immediately, the area's support for Justin Trudeau's Liberal Party dropped off the cliff. So, after years of refusing any conceivable relief or delay on the carbon tax, the prairies asked for this constantly, Ottawa suddenly greenlit a carbon tax exemption on home heating oil, a particularly dirty way to heat your home that is used almost exclusively in the Atlantic provinces. If you heat your home with cleaner natural gas, you still pay the tax. Some rather brazen politicking, and it's why even carbon tax supporters, such as the NDP, are now rapidly veering towards a sentiment of, okay, if we're not going to take this seriously, let's just scrap it. Justin Trudeau's premiership hasn't exactly been a whirlwind of policy triumphs, but the one exception, and the one he bragged about most when hanging out at foreign galas, was the carbon tax. Canada became one of the world's only countries to do what economists have been telling everyone to do this whole time.
What's the matter, Jack?
If you're worried about emissions,
Hence the dating app designed to be deleted. So find the person you
Woosa. What? What is the matter with you?
We have some breaking news. Dr. Anthony Fauci will testify before the Republican-led House Committee on Oversight and Accountability next January per a statement released by the committee this morning. Fauci will sit for a transcribed interview to occur on January 8th and 9th of 2024. 7 hours of testimony, excluding breaks per day, has been allotted for this interview. And the big news, a public hearing is to be at a later date to be announced. Okay, so many people have been wanting some kind of accountability, and it looks like this might be at least the start of it. It's a lengthy opportunity for people to directly question Fauci in a public forum. Something like this hasn't happened in a long time. Obviously, he hasn't been in his position at the CDC for quite some time. He has done interviews and things like that. But this kind of adversarial hearing is, I think, going to be a breath of fresh air for some Republicans who've been looking for answers.
Yeah, I mean, especially considering bureaucrats who are unelected don't typically get held accountable for the decisions that they make in the name of elected government. And he is someone who repeatedly lied to the American people. He was involved in directing the publication of a paper rejecting the idea that COVID could have been a lab origin. And called people conspiracy theorists when they said that maybe this didn't come from a wet market.
Oh my God.
Admitted to lying on one occasion what the threshold was for America to have reached herd immunity in regards to the COVID pandemic, saying that the American people weren't ready to hear the true percentage of people who would need to be vaccinated or have had natural immunity in order for us to return to normal, so to speak. And of course, between him and Deborah Birx, there were also all kinds of moving of the goalposts in regards to mask mandates, social distancing, vaccine mandates, and whether or not the vaccine even prevented you from getting or spreading COVID in the first place. And there's also this really strange connection that is not talked about a lot between Fauci and Harvard, where he helped facilitate a donation from a Chinese business called Evergrande to Harvard Medical School in the beginning stages of the COVID pandemic. And the suggestion, based on documents that have been reviewed by investigative reporters, is that this donation was given in exchange for downplaying China's failures in preventing this from becoming a global issue. So he has a lot to answer for, and I'm really looking forward to this.
Yeah, I'm most interested, I think, in the discourse around lab leak. I do think that a lot of the criticism that he's received over basically not trusting the public enough to tell the truth, whether it was about the efficacy of masks or whether it was about how many people needed to get vaccinated for herd immunity to accrue. That has been kind of litigated out in the public sphere. As you pointed out, he kind of admitted to taking this position repeatedly of, well, I can't trust the public with that, so I'm going to misrepresent it so they do what I want them to do from a public health perspective. But the stuff that I think it'd be worthwhile to kind of cross-examine him on and get him to really engage with documentary evidence that's come out on are these questions of whether or not he forced people's hands to make conclusive statements about how unlikely lab leak theory was and what his role was in downplaying funding for gain-of-function research, knowing what risks were involved. It's been somewhat of a black box since so much of this obviously happened in China, but there are some competing theories about whether similar kinds of research is being done domestically, and whether the concurrent research is part of why there's been this cover-up as well. That, I think, has more long-term implications as well, going into a potential next pandemic. If this kind of research is ongoing, if it is dangerous, and if it cannot be done with the safety mechanisms that we would all hope were put in place in the first place, then it should be stopped. That has more, I think, public value for me at this point than perhaps relitigating some of the stuff about the masks and the vaccine shots, just because I feel like that is out there, and hopefully our public health institutions won't try to know better than the American public going forward. But for Fauci as an individual, what his personal accountability is, I think that there's a lot still to be unplumbed when it comes to gain-of-function research.
Yeah, I mean, especially considering it's not up for dispute that the NIH was funding gain-of-function in Wuhan, although Fauci likes to quibble about the specific definition of gain-of-function research when the way he describes what they were funding is gain-of-function. He just doesn't like to use that term. And if he lied about that, he testified to Congress previously where he said that they weren't doing that. And so there's a potential perjury case to be made here by the Republicans in the House Oversight Committee. I also really want them to dig into the effects that this had in terms of these deaths that were not related to COVID but occurred because of some of the policies that took place. A rise in suicides, for example, especially among young teens. A rise in late-stage cancer diagnoses because people were encouraged not to go to the hospital unless they had COVID. They were encouraged not to go to the doctor, for example, to get routine health screenings because they needed to make way for people who had COVID. And then the effect on kids who were pushed out of school at the direction of the CDC because they believed that children were like super spreaders of COVID. And it turns out that they were not only the least likely to have severe infection or death from COVID, but also were not as likely vectors for the disease, and that schools were one of the safest places that kids could have been during the pandemic. Just looking at the data that we have now of how many secondary infections occurred in schools. And we have probably a mental health crisis and a learning loss crisis that we haven't even begun to really reckon with. The New York Times of all outlets, I mean, to see this in the mainstream media now, published a piece a couple of weeks ago where they acknowledged the massive detriment that pandemic policy is going to have on kids for decades to come. And when kids at that age are unable to get access to education or some of the other resources that they have when they go to school, you can't just get that back. Those are such formative years that I think we're yet to really reckon with and see the true consequences of what we did to children.
Yeah, I mean, I do want to caveat this because I do think that we collapse the COVID timeframe and forget that there really was a year during which there were no vaccines and that people were dying of COVID, including people who were otherwise healthy. It wasn't just this idea that there was an overly diabetic, all of these, pre-existing conditions, group of people that were exclusively the ones that were victimized. And also, it's also worth noting that a significant portion of the American public is dealing with those kind of preconditions, and their lives are not any less valuable, and they were genuinely vulnerable, and many of them continue to be vulnerable. But the question about how quickly policy should have changed once vaccines came out that dramatically decreased people's death from or severe illness or hospitalization from COVID, I think that's a very legitimate question, and how certain districts should be responsible for perhaps extending school cancellations for longer than was perhaps medically recommended or should have been medically recommended at the time. One last point is that I really do hope Democrats consider whether or not they want to let this be a purely partisan exercise. The issue, the kind of salience of COVID in the political debates has diminished, I think, considerably over the last year or so since the mandates went out of effect, and there seemed to be less of a linchpin to be angry at various things, rightly or wrongly. But the ongoing concerns about public health messaging and some of the funding practices of perhaps dangerous research shouldn't be owned by the Republican Party in a way that could diminish the legitimacy of Democrats going forward, or if you enter another pandemic. And if you want to address the crisis in public confidence that exists post-pandemic, vaccination rates for every other childhood disease are diminishing. They're at record lows now because of people's lack of confidence in public health. Then you're going to have to stop allowing this to be a partisan exercise by making it a partisan exercise. And I'd like to see some Democrats engaged in good faith in the questioning of Dr. Fauci in January.
Sure, and now we have the military now begging people who were fired for being unvaccinated to come back because, of course, there's a shortage, and there were a lot of lives that were destroyed by the vaccine mandates by individuals who were had to choose between being able to support themselves and their family and whether or not they wanted to get this vaccine that was still an emergency use authorization. And then I would also just add one more point, which is that even before the vaccine came out, there was very good data on the susceptibility of children to catching serious cases of COVID and spreading it to others. And yet there were school districts that were closed for entire school years. College campuses, in many cases, had vaccine mandates for otherwise young and healthy people at the expense of, in some cases, people's ability to go to college. And I have family members who were starting as freshmen in college during the second year of the pandemic, 2021, and were basically locked in their dorm rooms all day and had to do all of their classes over Zoom while still paying exorbitant tuition. So there's just so much that, yes, has been debated publicly, but maybe we haven't fully wrapped our heads around just the extent of the consequences of the decisions made by people like Dr. Fauci and Dr. Birx. And I hope that this is the start of a longer conversation of how we prevent this massive failure of public health policy from happening again and restore trust in the system. We'll be back with more Rising after this.
Oh,
I know a place that will break you into 1,000 pieces. Stay away from them. Stay away from Lorca and Picasso. Don't ask about Lola. But in spite of everything, it occurs to you to visit Andalusia. Don't say I didn't warn you. Careful of the Andalusian crush.
oh.
Hello everyone, I'm Emily Calick and